Well, hello and welcome to the Cleveland Clinic Virtual Weight Loss Surgery Seminar. My name is Jesse Gutnick. I'm one of the bariatric surgeons. We've got a great panel today, including Karen Schulz, who is one of our obesity medicine specialists and also the coordinator for our program, as well as Jamie Sarver, who's one of our coordinators, a nurse, and also one of our patients. And she'll be in both roles, both telling you something a little bit about her own journey as a patient and they'll be able to answer questions about the program. During this entire program, please feel free to send questions into the chat. We'll have some time for question and answer at the end, but you can send them on in during the whole session. Just to give you a quick rundown of the order we're going to look at things, we're going to first hear Jamie's story, and I'm going to talk to you about how weight loss surgery is effective and how it's safe. Ms. Schultz is going to go over what to expect at our Cleveland Clinic program, and then we'll do our Q&A. We already discussed, please submit things via the chat function. And with that, Jamie, I'm going to turn things over to you to go through your story.
Awesome. Thank you so much. Hi, everybody. Thanks for joining us. My name's Jamie. I'm one of the nurses here at the Bariatric and Metabolic Institute, as well as one of the program coordinators. So you can see from this picture, this is actually me in 2019 at my one of my highest weights ever, and ready to just kind of start my journey of weight loss. So next slide. This is actually an ongoing picture process that I keep getting with my surgeon, Dr. John Rodriguez. He currently works in Abu Dhabi, but he was one of our bariatric surgeons that did my surgery. So you can see a year after that, September 2019 picture, 1 year later in September of 2020, that's me with my surgeon. And then in the middle of 2022, and then more recently, just last week, actually, that's the most recent picture of me with Dr. Rodriguez in 2023. Next slide. So I like to just kind of give everybody a little bit of information about me, specifically in my case prior to having bariatric surgery, just to kind of paint that picture of what made me decide to go through with having a surgical procedure. So prior to bariatric surgery, right around that time, I was 34 years old. My highest weight was 253 pounds, and I'm a short person. So I'm 5'1", and so my BMI was, right up there in the like 45 range. I didn't really have any significant health conditions, but I have family history of them. So I knew that there were things that were going to start creeping up on me if I didn't do something about my weight. The really biggest things that I had polycystic ovarian syndrome, which is also called PCOS, and infertility. Like I said, I have a family history of obesity on both sides, but primarily my mother's side. And with that, there is type 2 diabetes. And so for me, there was a real concern there that as I continue to have this weight stay on me for a while, that I potentially could be looking at getting diabetes. My mother wound up getting it. And I also saw my mom struggle with obesity all of her adult life. As I was a kid, she was always heavier. And so I really saw her kind of like go through all of those struggles. And I was like, I don't want that for myself. And so that was one of the things that really helped me to kind of make up my mind as far as what I wanted. I had also considered having bariatric surgery for a while. And even before I even started working here, I knew that was an option and that was a weight loss procedure. But I really didn't know how to actually get there. I knew that there was those things out there, but I didn't have the resources or information on how to even have bariatric surgery. And if it was safe or what, until I actually started working here, I started learning all of the, science behind the procedure and why it's effective and all of that kind of stuff. And then I had also during that time tried diet and lifestyle interventions, but they were really ineffective for me. I would exercise and eat better for a while. I even was on medications, and I'd lose 20 or so pounds, but it would just start creeping back up, or I would wind up gaining even more weight, all of those types of things. So for me, I felt like I need to do something. I kind of made that decision once I was at that highest weight that I need to do something, that it's time for me to stop, messing around with these, things that are only going to work temporarily. I need something that's going to help me have a lasting effect. So on December 13th, 2019, I went for it. I had bariatric surgery. That day, I think I was in the hospital, or it was like the time in surgery was about an hour and 20 minutes. My weight the day before was 233 pounds. I currently hold like my weight between 120 and 125. I kind of fluctuate, but for the first time ever, I'm never really paying attention to the scale on how much I weigh now. It's been great. That's a great feeling of like, I don't need to worry about what my weight is, because I know my weight is well within the normal ranges, or within that BMI that says I don't have, any issues there. Like I said, my time in surgery was about an hour and 20 minutes. I was in the hospital for 1.5 days. And really, that's just kind of dependent on how your body does after surgery and how you do after surgery. It's not a race to get out of the hospital. Primarily, you stay in the hospital between 1 and 2 days, 1 and 2 nights. It just kind of depends on how you're doing and making sure that you're taking in fluids and not having any issues. My recovery time, initial recovery time of like that, oh my gosh, you just had a surgical procedure, was about 3 days, where I was just kind of like, I'm doing nothing besides just focusing on myself. That was really just like 3 days of, needing some of those extra pain medications to kind of help, minimize that pain, and really just kind of being careful walking around. But I was up and moving on all three of, like, within those 3 days. I was up going upstairs and all that kind of stuff. It was just, I was taking it much slower. And then I was actually back to work within 4 weeks. I had no issues. Like, I was up and moving, and 4 weeks I had no problems, and I have not had any problems since. So I felt like it was a really like positive experience for me. Next slide. So I like to include this slide just so that you can kind of see, like, initially there was, before the surgery, you can see my weight was about 250 pounds. This is, over the course of like January 2018 to, January of 2023. So it's a good amount of time for you to see like how my weight has kind of changed and how it's stayed, stable this entire time since I've had surgery. But you can kind of see my weight was up at the highest point before surgery. And then I kind of started losing weight, knowing, hey, I want to lose a little bit of weight before I actually have surgery, just so that it kind of helps me to, get to a lower weight after surgery. So you see that they, at 6 months, that was the most, drastic weight loss and most quick weight loss. And then as you see, like, I kind of started like leveling out between 6 months and 1 year post-op. And so I kind of maintained that weight, didn't really have any issues. And then as you can see, throughout those 2 years, I've really been able to kind of maintain at that like healthy level without any kind of issues. Next slide. So I like to also include some of my post-op milestones, which are important. These are things that people kind of ask, within that first year, like, what should I be expecting during that post-operative time? The first year is kind of really like you're learning your body again. So those first 2 to 4 weeks, that's where it's like the least amount of fun. You're on a liquid diet, and protein shakes are essentially your main nutrition source. So you'll get sick of protein shakes. So it's really important during that time. Just know, yeah, this isn't the most ideal thing, but I'm trying to make sure that I stay healthy. I stay like not malnourished or not having any kind of issues. So it sucks, but you kind of get used to it, knowing like it's going to get better. And then you want to really, during this time, work to reach at least one of your protein or water goals daily. Your dietitian that you work with in our department, they'll provide you like what amount of protein you need to meet based off of your body. It's like a calculation that they do. And so they'll provide you with that information. But making sure that you're getting either the protein or the water in daily is the most important thing so you don't get dehydrated. And then that just sets you back a little bit more. Another thing that was important during that time was really get up and get moving and start working on like setting routines. You know, you have some of that time off to make sure that you're starting to like incorporate like a better, healthier habits during that time. I just kind of focused on doing that during that 4 weeks that I had to recover. My surgical pain, by the time I was even 2 weeks post-op, there was like minimal surgical pain. It was really just if I was bending over or if I was doing something that maybe I really knew I shouldn't be doing. That's when I would kind of feel a little pulling or something like that, but really minimal surgical pain. At 1 to 3 months post-op, I was hitting my water and protein goals daily. I was able to get both of those in. I didn't have any issues. Food was still kind of like one of those things where you're kind of like learning like what I can eat, what I can't eat, what's going to make me feel full faster, all of those things. And you're also kind of like, at that time, I was really learning like the label reading of like, I need to make sure that I'm getting in the amount of protein that I need to get in. So I'm looking at every single label. Does this have too much sugar in it? Does this have enough protein? I'm only going to be able to eat half of it. So I need to make sure that I'm getting, you know, the maximum amount of protein in every single thing that I purchase. Your weight loss is really, really noticeable, not just to you, but to other people. I was coming into work on a regular basis, like every single day. I was having somebody that just saw me the day before and they're like, oh my gosh, I like just saw you yesterday and your face looks different even today. So you can almost see like daily, there's a major change in your weight during this time. And also one of the things that I noticed right away, as soon as I went back to work, it was like almost like my first day back at work. I was like, wow, I'm not even having any pain. I'm not having any hard time like walking upstairs, like getting winded, walking down the hall or anything like that. I already was feeling like my activity level is completely changed just from, you know, a month ago. So it was really noticeable just right to me at that point early on. At 3 to 6 months post-op, this is when I say food is finally your friend again. Some of that internal swelling around your stomach, your new little stomach, kind of goes down, and you're finally able to eat a little bit more and incorporate a little bit more variety into your meals. And so you're kind of starting to wean yourself off of those protein shakes and not rely on them as your sole nutrition. So that's when you're kind of starting to be like, okay, I'm eating to like enjoy food again, as opposed to like eating to stay alive. But you're also really during this time still losing weight at a really good pace. It's crazy how rapid that weight loss is in that first 6 months. So during that time, I was really trying to just be careful on like what kind of clothes I was getting, and more like getting stuff from like friends and family that maybe it wasn't fitting them anymore, like that kind of a thing, just because I knew I was losing weight so rapidly. It would be like one thing I would put on, and then the very next day it was so big and baggy on me, I couldn't even wear it again. Another thing during this time, my activity level really at this point had really improved. At 3 to 6 month post-op, that was about summertime, and just the amount of stuff that I was able to do out in my yard without feeling tired, without feeling like, oh my gosh, I need to sit down, my back is hurting or my legs are hurting from being up. I immediately noticed that completely different thing. And even my husband at the time, he was having a hard time keeping up with me. At 6 to 12 months post-op, we're still having that you had a good amount of weight loss during that time, or between that 6 and 12 months, you still lose weight, but it starts to slow down. And then your protein and water goals, you're hitting those every single day. If you're not hitting those, it's kind of like, you know what you didn't do, and you've kind of worked out that like your routine essentially. You're also really at this point kind of comfortable with your anatomical changes. By the time I was 12 months post-op, I knew if there was certain things that I shouldn't be eating this, it's making me feel sick, or it makes me feel too full and it sits kind of in my chest. You really kind of start to get to know what's going to affect you and what's not. And I know this is a common question, but it just depends on, every person is going to have a different reaction to certain things. So some things that bother me may not bother anybody else, but it's varied on that. And then there were also at this time, like I recognized like many changes in my confidence level. Like I felt like I was able to speak up more. I felt like I was able to like, you know, not be worried about like what other people thought of me as much as far as like, you know, just that feeling of like, I don't want to draw attention to myself. And so changes in my confidence and things like that were a big, something noticeable to me. Another thing I like to mention is like the relationship, even with my husband, kind of changed. He was supportive the entire time of me having bariatric surgery. He knew that that was something that I wanted for him. He didn't care. Like that was like, I don't need you to have it. I think you're beautiful the way you are. But he also knew that for me, I didn't feel like myself being that at that weight, and I didn't feel comfortable with myself. So he was supportive of it. But it really did kind of change afterwards because he really noticed those changes in my confidence and my ability to even do things in my activity level. And it kind of made him feel like he like needed to step up his game a little bit and, you know, get on the same level as me and start eating better and eating healthier and all of those types of things. But then on top of that, it really changed like even like when he would be out and we would see people, he'd be like, look at Jamie, look at how great she looks. Doesn't she look so good? Like all of those types of things for me were actually like, you know, positive experiences that my husband, you know, even though he didn't really care that I had this bariatric surgery, he was still supportive, didn't think I needed the surgery. But then even afterwards, he was like, wow, this really did make a serious impact and a change on you. And I'm glad you had this, you know, done as well. And then I also like to say, like during this time, you really notice some of those like non-measurable goals. Like it is so crazy to me, even still, like some of the things that I realized that I wasn't able to do that I was like missing out on, like being able to stand up and put a sock on, and like your balance just changes. And like even me now, like I go up on my roof and climb up on my roof, and I'm not afraid to go on a ladder, or like all these types of things like that. You really like, you can't put a like a weight or a measurement to that, but just having the like confidence and the ability to be able to do that is completely different once you realize like those changes. It's noticeable at this point. Next slide. So now that I'm past 1 year post-op, I'm going on almost 4 years. It's crazy to me. But I like to talk about, how do I maintain this? I look at this as like, I made an investment in myself. I made a change. I took all this time off of work. I did all of this work to lose all this weight. How am I protecting this now? Because it's, you probably have heard people say all the time, oh, I know so-and-so, they had this surgery and they gained all their weight back. So what am I going to do to make sure that that doesn't happen to me? I don't want to be back in that same place I was 4 years ago. So every single day, I am still mindful of how much sugar, how much protein, how much water I am getting. I still look at labels to this day. When I am grocery shopping, how much protein does this have? Because I'm probably only going to be able to eat half of a serving, and I want to make sure I'm maximizing the amount of protein that I'm putting in my mouth every single day. Same thing with sugar. Sugar for me can still make me feel a little bit sick because I had that gastric bypass. You kind of have some of those like lingering effects of it. And so I can feel a little bit sick depending on how much sugar or how much carbohydrates I eat at one point. And I don't want to feel like that. So I monitor how much sugar I'm taking in. As far as water goes, again, that's really important. Making sure that you're getting in your water every single day is still really important. And to this day, I still have to drink, you know, or eat a protein bar or drink a protein shake or something like that, just so I can make sure I'm hitting my protein goal. Another thing that I did not do that I talk about now as so important, I talk about exercise and weight resistance training. And I work in this department, and I hear our providers every single day say, you know, you need to start exercising, you need to start weight resistance training. It's going to be so important for you after surgery. It's going to help you to with the excess skin and all that kind of stuff. And that went out the window for me when I had surgery. I was like, oh my gosh, I'm losing so much weight. I don't need to exercise. This is amazing. And then at about that 6 months is when I started slowing down, and I was like, I'm doing everything that I'm supposed to be doing. I'm getting all the protein in. I'm not eating too much carbohydrates. I'm not doing all these other things. I'm pretty active. What's going on? And I was not actually exercising or doing any kind of resistance training. And I have a picture. I'll show you. There is a major difference. Once I started doing that, I wound up losing like another, little bit of weight. Like I think it was like 10 pounds or so. I started losing again. But I also started immediately noticing a change in just my tone and where that fat deposits were and what my skin was looking like. So it's so important to actually do weight and resistance training. I can't say it enough now because I really wish I would have done it sooner and I didn't. And then also some other things that are really important is continuing your daily vitamin regimen. I was taking vitamins before I had surgery. It was not a change to me. I still take one vitamin a day. And then I take a couple calcium pills or chews, and that's not a problem. I actually take less medications now than I did before I even had surgery. And then another thing that's really important from a medical side, from the nurse side, and working with the team that sees our post-op patients, keeping up with your post-op appointments. It's absolutely necessary. People think like, oh, I'm just going to have the surgery and then I never need to see you again. Once you have surgery with us, you're part of our family. You're part of our team. We want to see you for the rest of your life, essentially. And part of that is to make sure that we're running annual labs on you to make sure that you're not deficient in certain things, but also so that we can help you kind of maintain that investment in yourself. It's one thing if you've gained 5 pounds and you notice that your annual visits every year, like I've gained another 5 pounds, or I'm not losing any more weight, or those types of things. It's easier to make an adjustment on 5 to 10 pounds of extra body weight as opposed to, waiting 5 years and then having a problem and coming back to us. And maybe you have regained all of your weight or you've gained some of it. And now you got to work even harder to get that investment back. And so it's really important to maintain those post-op appointments. So I'm going to show you this next slide is the picture that I want to show you for exercising. So go ahead and forward the screen. All right, so here we go. The summer of 2020, like I said, that was like about 6 months post-op. I started slowing down in my weight loss, and you can see there's my picture. I was 165 to 170 pounds. I was so happy with that weight loss. It was great. I loved it. But I was like, I'm starting to get a little nervous. I'm not losing any more weight. And then in the fall, I started exercising with my sister. I only have a home gym. I have not purchased a gym membership at all. I have free weights and I have a rower. And I actually have an elliptical too, but I can't use that. I let my sister use the elliptical and she just would come over and we'd do, 20 minutes of, some cardio. And then we would actually use the free weights and we would do a bunch of like free weight exercises and just toning exercises. And you can see in that picture, to me, it's so important because that's the first time in like 16 years that you can see abs and you can see like biceps. And I was just like, oh my gosh, this is amazing that like I can see the effects of me working out, because previously I was not able to see any of that. And so it made me not feel motivated to continue it. But once I got started and I started exercising, I was like, that was just blown away. And even my sister was getting annoyed because I was actually like having like, she was doing the same exercises and I was like, I have a biceps. So that was always like, that to me is like one of the most important and most powerful pieces right there that I try to share with everybody is just exercise is a piece of this puzzle. It's not the whole thing, but you can't just rely on that one little tool to just be the major change and then not do anything else. And so for me, that's, I believe, the last of my slides. Dr. Gutnick, if you want to forward it. Yep. So thank you so much for hearing my story, and I look forward to answering any questions that you might have at the question and answer section.
Thank you so much. And with that, I think that's a super powerful, one person's experience, which really demonstrates sort of the scientific things that I'm going to be talking about. So why is weight loss surgery effective? So in short, our bodies have a system that's almost like a thermostat in your house if you have a heating system or a cooling system, where it's designed to keep your weight at about a stable rate. So if you're trying to lose weight, it keeps you from that. If you try to gain weight, you tend to gain weight slowly and actually slower than you would expect. It was only about how much calories that you ate versus the amount that you expend on a daily basis. So you have sort of a weight thermostat. So when you're dieting, your body fights the weight loss. And weight loss surgery resets that thermostat at a lower level, essentially. How does it do that? Most importantly, one of the big differences between what happens when you diet versus have weight loss surgery is something called your basal energy expenditure goes up when you have surgery. So this is the amount of energy that it takes for you to just be alive, just like when I'm sitting here, how much energy my body's expending. When you're dieting, your body turns that down. That's why you feel tired when you're dieting. After bariatric surgery, it goes up. Similarly, your appetite increases when you're dieting. It's less after bariatric surgery. Along with that goes satiety or fullness. Your body's stress hormones go up when you're dieting versus go down after surgery. And then certain gut hormones that are signals that we think are the cause for all this change. And they both change in terms of what your gut is telling your body. And that's why you have less issues with diabetes afterwards, but it's also what these gut hormones tell your brain in terms of your hunger. I'm going to talk about all of the options to some degree, but I'm going to be focusing on gastric bypass and sleeve gastrectomy because they're the most commonly performed operations. Some other operations that are possible are the duodenal switch or the Sadie procedure and revisional surgery, but we're going to focus on these two. So this is on the screen left is the gastric bypass, and on the screen right is your sleeve. You may have seen these pictures before, but in short, a gastric bypass is a bypass of the stomach, and a sleeve gastrectomy, we make the stomach smaller and sort of tubularize it by removing the part of the stomach that increases in size when you eat a meal, called your fundus. And there's an incredible amount of data that's came out. Now, this is a little bit of an older study in 2017, not that old, but a little bit older now, but it was very landmark because first of all, it was a randomized controlled trial in weight loss surgery. And in particular, it was landmark because it was done in patients that have diabetes. And it was comparing people's, not just their weight loss, but their diabetes outcomes over time. And this was performed primarily here at Cleveland Clinic. And this, if you want to look at this graph, you can see on the up and down axis the change in the body mass index, which is how we measure your weight versus your height, and then over time. So this goes out to 60 months after the intervention. And they compared patients who got the best medical care compared to weight loss surgery, and you can see the big difference in the weight loss. Now, in this study, patients had about 10 kilograms per meter squared, 10 BMI points weight loss. These were diabetics, so that's a little bit. Diabetics tend to lose slightly less weight, but the most important thing about this study was over time, their A1C level, which if you're a diabetic or if you know about diabetic is what really counts in terms of your long-term health with diabetes, dropped way, way down. And you can see how much it went down 3 points for people with the sleeve gastrectomy and gastric bypass versus about 1.5 for the best medical care. And the best medical care one kind of went up over time much more quickly. And so you can see that this almost resets your body in terms of how it manages your sugars. Now, bariatric surgery is not only effective for diabetes. One of the reasons that we studied in diabetes in particular is because of the health, the damaging health effects of diabetes. It also has some good ways to measure how the diabetes is doing, like using that A1C. But the same goes, just like for the diabetes, for other health issues. Common ones are sleep apnea, asthma, blood pressure, and these kinds of things. And so all these things together, along with obesity, are called the metabolic syndrome. And the goal of weight loss surgery is hopefully to prevent these things from happening. But if you have these health issues, to stabilize them and even reverse them, like you see with the diabetes in that last study. With that, I'll move on to the safety profile. So when I talk about safety of surgery, there's two important things. The first is we have to see how safe the intervention itself is. And then we have to compare it to what would happen if you didn't do surgery. How would that compare? And that's what you'd call usual care. And basically, the risk of surgery is not zero, but it's very, very small. And the health benefit over time is enormous. So you may have heard from a very long time ago that bariatric surgery is risky. There was an absolute revolution in the safety of bariatric surgery in the 2000s when laparoscopic surgery was introduced. And you can see on this graph, beginning in 2002 and going into 2009, that in 2002 there were 4 deaths, or 4 people that had mortality out of 1,000 operations in 2002. And by the decade end, it had gone down to 0.6. So nearly 10 times lower. And this was just with the introduction of laparoscopic surgery in this time period, essentially. Now, since then, that line has continued. And as of 2021, which is the most recent published information that I could find, that looked at millions of patients, and now the risk, from the more recent trials, it sort of summarized all those trials, was a 0.08 risk of mortality. That's even almost another tenfold down over the last 10 to 15 years since that graph that I showed you. So let's compare this to some other common operations that people sort of don't think twice about. So let's look at some of them. So a CABG, this is a cardiac bypass, so not a gastric bypass, but like a heart surgery that you might get if you have what's called angina, like chest pain from your heart. And we're looking at the risk of any complication that's occurred. And it's, again, in diabetics. The reason this was chosen is people that have diabetes have a higher risk of complications after surgery for a variety of reasons. So if you want to look at complications and compare procedures, it's helpful to have a higher risk group so that you can really see the differences more easily. And so in patients that had a heart bypass, they had an almost 50% risk of some kind of complication after surgery. Colon operation, 12% risk. Appendix surgery, 4.5%. And then all the way down here, very similar to a hysterectomy, or that's a removal of a uterus, around 3.4% risk for any problem whatsoever after surgery. And so you can see that this is very, very low. Now, in terms of looking at health benefits, and this again is just one study, but again in diabetic patients, because health benefits are even larger if you have diabetes, and looking at over 2,000 patients in our system, this is a incidence of death not from surgery, but in the years following surgery. You can see in the people that didn't have surgery, that rate goes up at this sort of steady rate, and the people after surgery were lower. Now, this is a higher rate than you might expect, 10% incidence of death at 8 years. Remember that these were in patients that had diabetes, so that they had more risks of passing away, unfortunately, over time than somebody who didn't have diabetes. And this was achieved through fewer people developing heart failure, coronary artery disease, arrhythmia, stroke, kidney disease, or high blood pressure. So again, similar to the weight loss, you get the risk of surgery is small, and you get a tremendous health benefit for treating sleep apnea, diabetes, improving the safety of childbearing if you're a woman of childbearing age, improve quality of life like joint pain, so you're able to be more active. And you heard about the ability to get active from Jamie earlier. The most recent thing that we're learning a lot about over the last couple of years is decreasing risk of certain cancers with treating obesity, of course, treating fatty liver, and many, many more. So with that, I'm going to turn things over to Karen, who's going to talk about our program in particular and how we serve you.
Okay. Good afternoon, everybody. I'm Karen Schulz. I'm one of the obesity medicine providers at the Cleveland Clinic, also the administrative coordinator of our enterprise weight loss surgery program. So thank all of you for being with us this afternoon, and congratulate you on taking this important first step to learn more about weight loss surgery. So the Cleveland Clinic Bariatric Surgery Program, we're very lucky to have lots of locations, and we provide care as close to home as possible. In fact, we provide care in the home now, as a good deal of our visits now are done virtually. So it's a lot more convenient of course, the surgery itself, and usually at least one pre-op visit will be in person. But those of you that have a busy schedule, we can usually work it out with virtual visits. Those of you who prefer to come in person, absolutely fine. We always love to see you. Our centers right now, centrally at main campus. On the west side, we do surgery at Fairview with Avon. Avon is our outpatient center, soon to be a location in Westlake. East side, Hillcrest Hospital with our outpatient center in Twinsburg. And we are just now starting some surgery at Mentor Hospital as well. Next slide. So I wanted to thank you all for choosing us at the Cleveland Clinic. I know we're so lucky in Cleveland to have so many great choices for healthcare. But here's some ratings if you're kind of comparing from US News and World Report. We do have some excellent ratings. I think it's also fair to say that we're the largest and most comprehensive program in Cleveland for sure, maybe in the entire state of Ohio. We do about over 1,000 surgeries a year at our 5 locations. We have a really big team. So I think that's what's important. We have 12 surgeons, we have 8 obesity medicine providers, 7 psychologists, 7 dietitians, and an entire support team of nurses and other personnel to take care of our patients. Next slide, please. In addition to all those folks, each patient has a patient navigator. So some of you coming into the program may have some concerns about insurance. Is this covered? So one of the first things that we do in our program after coming in and registering is we assign patient a navigator, and that navigator is going to check your insurance to see not only, first of all, do you have coverage for bariatric surgery, but what are the requirements? So how many visits do you need? What maybe your out of pocket or copay might be, so that when you get to that operation, hopefully you'll be completely comfortable as far as the insurance piece of your journey. Next slide. So we organized all of our specialists into what we call like your care team. So everybody has a team. We try to keep them to be the same provider. Once in a while, you might have 2 dietitians instead of 1. You'll have an obesity medicine provider, it might be me. We have a psychologist and of course your surgeon, and we all work together to get you prepared for surgery. Okay, so we want to make sure the obesity medicine provider is going to work with your current medical team to make sure that you are as healthy as possible to undergo the operation. Our psychologist sees everyone at least one time to make sure you're emotionally and psychologically ready for the changes that you might feel after surgery. If you have a current mental health care provider, we will also our psychologist will work with your current mental health care provider. And various consultants. So some people ask, can I have surgery if I have heart problems or really severe diabetes, or even if I need a kidney transplant? And the answer is yes. We have a full array of consultants that can help us with any other medical issues that you might have to get them in the best shape prior to undergoing an operation. Next slide, please. Okay, so I guess that's the end of me. I'm going to bring the panel back on for our question and answer session.
So just a reminder, I've got a lot of great questions. Feel free to keep on sending them. Send them to all of us and we'll answer them of the panel. One of the most common questions is what are the next steps? So I'm going to put that up as we're going through our panel of questions. So the first question is, how would the gastric sleeve affect, or other weight loss surgeries, affect your gallbladder, and can I have both surgeries at once? You want to take that one, Karen?
All right, so how does it affect the gallbladder, right? That was the question?
Yeah.
So prior to having bariatric surgery, if you have a gallbladder, it's not required to have one, we will do an ultrasound to see if there are any stones in that gallbladder, because occasionally you might have heard that weight loss, really of any kind, can cause gallstones. So if you haven't started to develop those gallstones yet, Dr. Gutnick or one of our other surgeons is going to most likely give you a medication to prevent those stones from forming. So that's really it. If you already have stones, we probably would just keep an eye on things. Chances are you're not going to develop a problem. We're able to significantly reduce the chance of you needing a gallbladder surgery, though, with that medication.
Yeah, this is a very common question, and I think primarily because before we did laparoscopic surgery in the open time frame, if you had gallstones, often the gallbladder was taken out at the same time, just because of all the scar tissue that was formed during open surgery. But since we don't have open surgery anymore, scar tissue is not a big deal, so we don't need to do that unnecessary step for most patients. You know, Jamie, I'm sure you saw there's lots of great compliments to you throughout the comments. I was hoping some people were asking, and I was hoping you could go through what people's, you know, the common question of how long does it take me to have surgery after my first visit? Or are you there? Well, Jamie may have had a connection issue. I'll move on. I'll take that question in that case. So common question, probably the most common one that's asked. And the bottom line is it kind of depends. The thing it depends most on is what your insurance requirements are. Some people do, and many people do have a certain amount of dietitian visits that they're required to have over a certain number of months. And so if that's the case for you, that's how long it'll take. If you don't have one of those requirements, typically it's a couple months. That's between, and it can go much quicker depending on how quickly you take care of certain testing that may be ordered. If you take care of it very quickly, it can be even shorter. So then the next one, Karen, there's a person who has an LVAD, and just for the people that don't know what that is, that's a pump that's on the outside of the body that helps the heart support the heart's function. Am I able to have weight loss surgery? My heart doctor thinks that this can get me on the transplant list.
Yes,
Open to review
absolutely.
these, and can you talk a little more about that?
Yeah, I actually have 2 patients right now in my practice that have LVADs and that are working toward the preoperative requirements for bariatric surgery. So it is common for the heart transplant team to send people to our program as your BMI needs to be 35 or below in order to get that heart transplant. And I also have other patients that have been successful in losing weight, getting on the transplant list, and then actually having that transplant. The other thing about bariatric surgery and organ transplant I think is really important is you don't want to just lose weight to get on the transplant list, right? You want to lose weight to get the organ and to live a healthy life and not gain that weight back and jeopardize the organ long term. So a couple of really important things, and we're able to safely get patients who need organ transplant through the surgery on a regular basis. Most of the time that's going to be at main campus because that's where our heart team is located. But yeah, we do that.
Yeah. And to sort of follow that up on the flip side, someone asked, can transplant recipients have gastric bypass? And the answer is, absolutely. Just maybe 3 months ago, I did a gastric bypass on a patient who had a prior liver transplant. And it's really essentially the same as someone who doesn't have a liver transplant, except obviously you want to be careful about the transplanted organ. And so what I did in that particular case is I had a transplant surgeon assisting me for any part, so he was available when I had to take some scar tissue off of the transplanted liver. And I just had him around to make sure that precious liver was well taken care of. And so if you have other types of transplants, for example, a kidney, that really doesn't affect the surgeries at all because those are done outside of the abdomen. And so you can absolutely have weight loss surgery as a transplant recipient. We do work, carefully with your transplant medical doctors because they do need to monitor your anti-rejection medications after surgery to make sure that they're doing the job that they need to do.
There's a question here,
go ahead.
Dr. Gutnick, about the LVAD. It is common for people, once they get their LVAD, to gain some weight because they finally feel good and they're starting to eat again. So yeah, I've seen that a couple of times. Yeah. So surgery can help.
Yeah, for sure. And I'm sure you've seen this several times, Jamie. Common question. My BMI is 40.5 and my insurance requires that it be over 40. What happens if I lose weight prior to surgery and fall below 40? What happens to my qualification?
Yeah, so that's important. So usually we take your first appointment weight. So say you start off with the obesity medicine team or one of the dietitians or even the surgeon, whatever that documented weight is in there, that's going to be that first one we're going to take. And then as you work through our program, maybe you have some requirements that you have to meet, like your insurance requires 3 months or 6 months of medically supervised weight loss. If you're losing weight around that during that time and you fall below that 40, a lot of times your insurance is not going to like stop you from having bariatric surgery because we're using that first weight that you were above that 40 level. And so it's going to sometimes be patient specific, and that's really important for you to talk to your patient navigator about if you're really, really concerned. But for the most part, as long as your BMI is above 40 when you first start in that first visit, and then as you work through it decreases, it's usually not that big of a deal.
Yeah, most insurance policies have specific language saying that that's okay as long as you have a one or several weights at the weight that's required. And I've not ever had anybody rejected for losing weight prior to surgery. One question to you, Jamie, and I already know the answer, but maybe you can talk about it a little bit, is did you have any surgery to remove any excess skin after your weight loss? And maybe talk about it more generally also.
Yeah. So I did not. I did not have any kind of skin removal, and I don't feel that I need to. I have a little bit of a belly and some stretch marks because I had a baby 18 years or 17 years ago. But to me, that's not a problem at all, and I'm not worried about it. I don't have any excess or hanging skin. I attribute a ton of that to that weight resistance training that I say is really important. That's why I really don't have a ton of extra hanging skin. But also, is your BMI is between like that 40, even 50, age is going to play a factor in that. Just your skin's elasticity is going to play a factor in that. Where the, hanging skin may be or where that excess skin already currently is. There's going to be a bunch of different variables, but there are ways that you can really make sure that you're trying to minimize that excess skin, and the weight resistance training is really, really important, as well as trying to work on some of that weight loss prior to bariatric surgery. For me, I felt like that was important, is to start losing a little bit of weight on a more slower pace, so that, you don't have that rapid weight loss where that is, sometimes where that excess skin can kind of start happening is because of that rapid weight loss. There's no muscle change right there. And so you wind up having some of those issues that way. But working on resistance training, making sure that you're just doing your part as far as that goes. Most of the patients, not everybody really needs skin removal surgery. If you have skin issues during that time, maybe like skin folds, like rashes in your skin folds, or infections. Some people even get cysts, things like that. That's going to be really important to make sure you document with the obesity medicine provider, or document it with your primary care physician, or go and see a dermatologist. All of those types of things are going to be one of the things that's going to help you get insurance coverage for skin removal surgery if you do need that. Our department does not do that, but we can refer you to the team that does. But a lot of times that's, questionable whether or not your insurance will cover it. So just keep, that documentation that you actually are having issues on a daily basis related to, your excess skin, and that might help you get insurance covering some of it.
All right, Karen, I'm directing this one at you. This person's spouse had weight loss surgery several years ago and had to take daily injections of blood thinners after surgery once they were at home. Is this common, and how do we figure out if somebody needs that for their safety?
Okay, we do a lot of things in our program to prevent complications, and one of those is for people at high risk for blood clots. We may have you go home on a medication called Lovenox. So that's going to be anywhere from 4 to 6 weeks. It's not the majority of patients. I don't know if we have a percentage on that, but it's for people who have prior history of personal history of blood clots, patients that maybe are in the higher BMI level, so BMIs over 60. And if that is necessary, we will teach you how to do that in the hospital and make sure that you have that medication.
Great. I'm going to throw another question to you because I don't know the percent. I could guess it, but you may have a better sense since you're the program manager. Several people have asked questions about having weight loss surgery after the age of 60. How common is that? What proportion of our patients? My guess is for my practice, it's approximately 15 to 20% of people over 60. But you may have a sense of the program at large. I don't know if that's the same as everywhere, or maybe my practice slightly different than people's.
I think it might be a little higher than that, Dr. Gutnick. We've done patients up to age 80 in our program. Age is really, it's like any other risk factor. So if you're a healthy 60-year-old, you might be in better shape for surgery than the 25-year-old that comes to us. So we look at each individual attribute of our patients, and age is just a number. So we're looking more at, what is your fitness level? Can you walk a distance, or are you really short of breath? And those are the things that really determine risk, not so much how old you are. Is your physical fitness and your health issues. Some people will say, well, why would you ever do surgery on an 80-year-old? You're really not going to extend their life any. And the answer to that was in the patient who did have surgery at age 80, because his quality of life was amazing after bariatric surgery. So he was 80 years old, but he was in pretty good health shape. And after surgery, he was at the Y, swimming with his lady friends. He was having such a wonderful life. So I really think that because of the invention of laparoscopic surgery and all of our new technology, that we're able to do surgery much safely in age 60 and above than ever before in the history of bariatric surgery.
Yeah, when I'd add to that, it's somewhat common, often because people may not have had coverage, and then they're able to enroll with Medicare, and then are able to have coverage for weight loss surgery. And so we sort of, at least in my practice, I kind of see two areas. People of all ages get it, but you sort of see a couple of bumps of most commonly in the 30 to 40 range, and then there's a sort of second most common around 65 actually for me.
Yeah, good point.
And there's people everywhere in between, but that's sort of the two highest or most common ages that I see. A very specific question, but I think it's an interesting one. I'm going to summarize it. So this person is 65 years old, has high blood pressure, cholesterol, joint issues. Are they still a candidate for weight loss surgery? They have an interesting additional thing, which is they say this person says that they have a nodule on their adrenal gland, and are they a candidate? You absolutely would be a candidate for surgery. It'd be a good one. The one thing, since you mentioned it, since you mentioned the nodule on your adrenal gland that I'll talk about, is one thing we do need to make sure before anybody has weight loss surgery is that they don't have some other cause for weight gain that may make the surgery less effective than ideal. So if, for example, you have something like a low thyroid function, we need to make sure you're on appropriate thyroid medication to have your thyroid function be normal with the thyroid medication. So if you have low thyroid, it doesn't exclude you from surgery, but we might need to get you on the right dose of thyroid medication. Similarly, if you have an adrenal nodule, we have to test you for the oversecretion of a hormone called cortisol. which can make you gain weight even if you are on a very, very extremely low calorie diet. You'll still gain weight because of the cortisol. So we just need to test you if you have things like an adrenal nodule to make sure that nodule isn't producing abnormal amounts of certain hormones that would affect the effectiveness. And if you did, we would first remove that adrenal gland, let you recover from that so that you aren't making that excess hormone, and then do the weight loss surgery. Karen, another common question that I think is important: how does surgery affect, or does it affect, somebody who takes antidepressant medications?
Yeah, taking antidepressive medications is common, not just in bariatric surgery patients, but in people in America. It's important to stay on those antidepressive medications throughout the surgical process. You know, having surgery is a little bit of a stress, so we don't want to just stop your medications. Absorption of the medication sometimes is impacted by specifically the gastric bypass. If you're on an extended release medication, we're going to have you work with your doctor to see if you can take a shorter acting medication. So it will work a little bit more effectively. Also, sometimes we see as people lose weight, they might lose enough weight to lose a whole person. So not only do the antidepressive medications sometimes become less, some of the other medications that you might take, you know, blood pressure medication, sometimes those completely go away because you're losing weight. But any medication really may be titrated for the bigger you. And that's why it's very important as you go through the process to make sure that your primary care provider is also aware and on board so that they can kind of monitor those medications as you move forward.
Great. I'm going to answer the next one because I think it's purely surgical. This person had a prior hernia repair with some mesh. Is it possible to have the weight loss surgery? The answer is it's always possible, and almost always it's possible to do laparoscopically. Occasionally, people that have had extensive prior open abdominal surgery, if you wanted to do a gastric bypass, would need to do it open again because of the quantity of scar tissue. That's not typically the case if you had just a belly button hernia repair like this person had. And often, if you have had an extensive prior open abdominal surgery, it's often still possible to do a sleeve gastrectomy laparoscopically. And so, but you know, occasionally gastric bypass, even though you've had a lot of open abdominal surgery, is the right way to go. And so we occasionally do them open, but that's well under 1% of our operations. There were several questions in here about some specific employee health plan benefits for Cleveland Clinic. I think you answered completely in the text, Karen. I didn't see any that I don't think you would have not addressed. There were several questions about the registration questionnaire. I think the first thing you can do is follow it. Hopefully the screen is still up, and follow these next steps recommendations in terms of how to register. What you do by filling out the question registration is provide your insurance information so that we're able to get that information. Two things. Number one, we're able to get you information about what your insurance coverage and requirements are in terms of whether you have a mandatory number of dietitian visits or anything like that, and also schedule you for your first one. Were there any further questions that you noticed, Jamie or Karen, that we didn't go over going through the checklist?
I think there was a couple questions about like maybe what's the benefit of the sleeve versus the gastric bypass. And from a patient standpoint, I'm happy to answer why I felt like the gastric bypass versus the sleeve.
Yeah. Please do.
So for me personally, I'm a cause and effect type of person. Both of them are great surgeries. They're durable. It really just kind of depends on you and your discussion with your surgeon of what what surgery is going to be safest for you. But with the gastric bypass, you can expect that you're more likely to lose some more weight from that surgery. So that was number one for me, is I wanted to come in I was sick of trying. I was sick of fighting all my weight loss. And so I wanted to lose the most amount of weight and get the best bang for my buck. And then in addition to that, you have a thing called dumping syndrome that can happen, and it's more common in patients that have the gastric bypasses than it is in patients that have the sleeve. And part of that is because there's some changes to that your small intestine that actually happen. And so when you eat sugars or simple carbohydrates, things like that, as I mentioned in my slides and my story, that it can make you feel a little bit more sick. Dumping syndrome is not just automatically you have diarrhea and, you know, these types of things. It's more of like that feeling you get when, even as a kid, you ate too much candy and now your stomach hurts and you feel racing and jittery and you feel like you need to just go lay down. That's really what that dumping syndrome feels like to me. And so, for me, being a cause and effect type of person, I wanted that surgery because I knew that that was going to be important for me. If I ate this stuff that I know I'm not supposed to be eating in the first place, then these things are going to happen. And so that was actually part why I actually chose that procedure, is because I want to make sure that I have this ongoing, like, you messed up and you did something you're not supposed to do, and now you're going to feel the effect of it. And I really feel like that truly helped me to continue to lose weight as well as maintain my weight loss, continue to be, monitor how much sugar and how much simple carbohydrates I'm eating, just because I don't want to feel sick. I want to still be able to function, those types of things. Do I still eat sweets? Yes, I'll have a cookie here and there. I'll have a piece of cake at a birthday party. I'm going to have a piece of candy if I feel like I need to have a piece of candy, but in moderation and much more lower level, or I'm looking at, lower sugar type options as far as what I'm going to eat, just because I don't want to feel that feeling of, the dumping syndrome. So to me, I felt like that was actually one of the biggest reasons that I chose the gastric bypass over the sleeve. But again, you're going to have that discussion with the surgeon, and it's going to be so important for you to kind of weigh out those like safety things and the pros and cons of each of the different surgeries before you have that, before you make that decision.
Yeah, the only thing I would add is that, it's really there's a couple things we're looking for when we're thinking about the operation from a medical standpoint. The first is, are there any that are not a good idea for a particular person? Because you might have certain medical condition or prior surgical history that makes one just not even an option. And so, as the surgeon, I have to figure out if that's the case for you. And if that's the case for you, then that one's just not a good option. That's unusual, but it's not extremely rare or anything. But beyond that, it's then just a process of education on what the differences are, seeing how they align up with your goals between weight loss or maybe other symptoms that you have, gastrointestinal symptoms you have, how those line up, so we find which one is the right one for you in particular. Another quick, I want to answer this because it's actually a very interesting question. Quote, I'm on bioidentical hormones. I've been told I will be okay because they're bioidentical, not synthetic. Do I have to quit them before surgery? Bioidentical hormones are sort of an interesting area. It's a little bit of a misnamed title. The bottom line is it depends on the hormones that you're on. You probably do not have to quit them. You could do surgery on extra hormones, but you may need to be on blood thinners because even if they're quote unquote bioidentical, they may increase your risk of blood clotting. So when you see your doctors, just bring up which ones you're getting and how they're being administered to you. Often they're in subcutaneous or underneath the skin implants. So just let your doctor know that you're using that therapy. But chances are, if you continue them, you may need some blood thinners. That person asked earlier about blood thinners. You may need to be on blood thinners after surgery. Several questions on to follow up. Someone asked, I just got diagnosed with hypothyroidism. Can I still have surgery? In short, the answer is yes. We had discussed this a little bit earlier. We just have to have you with a normal thyroid function level on your blood testing beforehand. And the reason why is that, number one, so surgery is as safe as possible. Number two, so that you lose the weight that you want to lose after surgery, which it'll be harder to do if you're not on the appropriate medication level. In terms of time off, Jamie, you said that you took off 4 weeks. Several people have asked about time off. Do you want to talk about why you took 4 weeks off? I think you especially then, had a little more a pretty physical job as a nurse?
Yeah. So I was at the time like one of our nurses that worked the floor. So I definitely had to be able to bend, pull, push, walk up and down the hall a lot. Just really kind of being more in a physical type of job. So that 4 weeks at that time was, needed as far as just from a bending, you can't really do that kind of stuff or lifting type things. So the 4 weeks was what I had gotten off. But depending on the surgeon and depending on your role, some of the surgeons are okay with you being off for 2 weeks. Really, 2 weeks is like the soonest we want you going back to work. And really, the biggest thing that's important to know is while this is not like a musculoskeletal surgery, like a knee replacement or something like that, that's going to limit you automatically for 4 to 6 weeks. It is still a surgery that it changes some of those anatomy, like your anatomy in your stomach, and it changes like your bowel habits and your routines and things like that. And so that time off, really, you need to actually protect that. You need to start thinking about making those changes and, starting your routine of your vitamins, starting taking, making sure that you're getting your water in. To me, during that 4 weeks that I was off, I developed, it takes like 30 days, they say, to start making changes and develop a healthy habits. For me, I took that time to make sure, okay, I'm going to make sure I'm getting my water in. I'm going to make sure I'm taking my vitamins every day. I took that time to focus on myself and make sure that I'm making these changes. So when I start going back to work and I'm a nurse and everybody's going to be asking me for everything and I'm going to have no time to think about myself, then I've already developed these habits that I can stick with because, I'm feeling like I'm dry in my mouth. I need to start drinking water. I've, noticed those things that I need to start paying attention to. So that when I'm at work and I'm distracted and not thinking about myself, I still have already developed that kind of like routine or habit where I kind of have those non-thinking cues that I need to focus on as well that just kind of help serve as reminders. So if you can take that full 4 weeks off, I recommend it just so that you can start developing those healthy habits. But if you're, really need to go back to work, 2 weeks is, kind of our minimum that we want you to be off of work for.
No, perfect. Well, in that case, I think we've addressed all the questions. I appreciate everybody for sending them in. We got some particularly interesting ones today, which I also appreciate in terms of the bioidentical hormones and the adrenal nodule. Those aren't usually brought up during this, and so that was kind of an interesting extra things we got to talk about. With that, I'd like to thank our panelists for being here today, and please look at our next steps if you're interested in learning more. We have a much more extensive seminar actually available that's video recorded as you register, and then of course this is just the beginning of your education on this. If you do move forward with the program, there's an absolutely extensive amount of education that you get during the process before surgery and after surgery. And this, we want this to be one of the most important decisions you ever take in your life. So with that, everyone have a great Friday and please enjoy the weekend. We look forward to seeing you.